Millions of children are back in the classroom in Kenya for the first time since last March, when the government closed schools in response to the COVID-19 pandemic. Students in grades 4, 8 and 12 returned in October so they could prepare for exams. Now all primary and high school students are back in school. DW visited one school in Nairobi on the first day back.
Kibera is one of the largest low-income areas in Nairobi. Here, thousands of people live close together, interacting on a daily basis. Social distancing is almost impossible. Now that schools have reopened, pupils are waiting in line to get in. Kenya is one of the last countries in East Africa to fully reopen its schools. According to the World Health Organization, prolonged school closures pose risks for children from poor backgrounds, like here in Kibera. For example, higher rates of teen pregnancies, poor nutrition and permanent dropouts. Some of the reasons why the Kenyan government said it was time to finally fully reopen schools. Janet Mwanzia is excited to finally bring her daughter Virginia back to school. Yet she's very aware of the risk.
Danger of many children is that they will spread each other for COVID if they have. Not even COVID only, even the common colds, other diseases, because they are many crowded together.
After they arrive, they have their temperature measured and wash and sanitize their hands. That's the new normal at Kibera Primary School for Girls. 347 girls are expected in the next few days, divided into classes of roughly 20 pupils. A distance of 1 meter can be maintained. But still, there are challenges.
To the wearing of the masks, of which is not easy for them because they have to be on the mask throughout the whole day. So you'll find them like they're telling you, we need to breathe.
The school is well placed to deal with COVID restrictions, as it can provide the water, space and masks to their pupils for free. Many other schools in Kenya cannot. It's possible because it belongs to SHOFCO, an international organization that's funded mainly by private American donors. Teachers here were trained by health officials. Some classes even have 2 teachers. Parents feel that children are safer here than at home.
We have it all. I would say we have it all. The children are privileged. They are able to social distance. They are able to at least get medical treatment, which is not common to everybody who lives around the slum.
Despite the measures, Virginia is just happy to be back at school.
And DW correspondent Mario Muller filed the report you just saw. She joins me now from our bureau in Nairobi. Good to see you, Marielle. So obviously, one school there that you profiled in Kibera, but how are schools across the country faring?
So up to 16 million Kenyan school children have returned to school on Monday. And have you seen in the report, there were huge lines that we filmed actually outside of public schools, and not the school, also of course the school where we filmed, but also outside public schools. So their conditions are quite different. It's not as safe, it's not as comfortable. Teachers there actually caution, and they say schools are actually overcrowded, underfunded, and therefore ill-prepared for a reopening. Because according to them, there were no new provisions taking place in order to maintain the social distance of 1 meter inside classrooms. And well, the Kenyan government said they will provide 7 million masks to children from poorer backgrounds, but at the same time they admitted they are short of 1 million masks. So in the end, it's clear that parents mostly have to step in and pay.
And how do people feel about schools opening after 9 months?
So actually, pupils' parents were very happy, especially the students, but parents were very worried also. They said, well, it's not very realistic. People, younger children actually playing outside, they hug, you know, you have to remind them constantly that they have to wear the mask. And also classroom size didn't change, they're still the same, but there are more children in some cases because private schools actually in Kenya had to close down, some of them at least because of the break and because of the loss of income. So parents had to look for new schools for their children, and these were mostly public schools. So that's a bit worry.
Mario, schools were closed for 9 months. How did that impact the curriculum, and what have education officials done in response?
So teachers we spoke to today, they told us, yes, they expect, especially younger children, that they have forgotten mostly, not everything, but a lot at least. So they have to, repeat a lot. In some cases, some schools were actually able to keep in touch, to bring paperworks to their homes, because in most schools, especially in poorer neighborhoods like Kibera, there are no laptops, no computers available, so that the children could learn from home. So these are very difficult conditions for many Kenyan school children, and so now they're expected to actually repeat a lot.
And briefly, Maria, what is the general COVID situation in Kenya at the moment?
So the numbers of cases and deaths have been reducing in the last few weeks, according to the Ministry of Health. And the Johns Hopkins University's latest numbers indicate that there have been nearly 1,700 death cases. Of course, always bearing in mind that there has the unreported case, the number of unreported cases is probably much higher. So now the biggest fear, also after the holiday season, people went, to visit their friends and family for Christmas, that the updated number might be much higher, and that schools could actually turn to a hotbed of the disease if the measures in place are not enough.
All right, that's DW's Mario Muller reporting for us in Nairobi. Thank you.